Hello and very good evening, and welcome to our session on the topic dealing with dysmenorrhea, painful periods. We are glad to have Dr. Joshita Nayak with us today to help us understand the topic. The doctor will help us more in details within the session, so stay tuned. And also, if you have any questions, any doubt, put that on the comment section so that our doctor can take it in the last of the session and solve all your doubts and queries. Stay tuned till the last to get more information about the topic. Now, doctor, you have the stage.
Hello, everyone. Welcome to another session of Facebook Live. Today, again, we discuss another common gynecological condition that is dysmenorrhea or painful periods. I am Dr. Joshita Naik, consultant obstetrician and gynecologist, Apollo Cradle Jayanagar, Bangalore. So, dysmenorrhea, coming to what is dysmenorrhea. So, as the terminology says, dys is anything associated with pain, and menorrhea is to do with periods. So, in brief, it's painful periods. This is a very common concern that we see in gynecological practice, and it's one of the most common concern for any woman during her reproductive phase, that is from the time she has her menarche till she hits menopause. This is one of the important gynecological symptom which any woman can have. So, coming on to dysmenorrhea or painful periods, why is it that some women suffer and some women don't? So, to understand that, we basically need to know a little bit about the pathophysiology or the reason why there is pain during periods. So, just to give you a little brief insight as to what actually happens in the body when a woman is having her menstrual cycle. So, as all of you all would know that, mid cycle there is an event known as ovulation, which happens where the egg gets released from the follicle. So once that happens, if there is fertilization with the sperm, then it can lead to a pregnancy, and then it's a different scenario altogether. But if there is no fertilization with the sperm and there is no resulting pregnancy, then the remnant follicle from where the egg has been released in the ovary, that remains, and that starts undergoing a degeneration. So, because of the degeneration of the corpus luteum, as what we call it, this leads to a drop in the hormonal levels. Precisely, there is progesterone withdrawal. So, when the progesterone withdrawal happens, there is a release of local prostaglandins which happens inside the uterus. So, this is predominantly what is responsible for the pain that is associated with periods. So, the effect of the local prostaglandins is what leads to pain during periods. Also, there are other concerns which can be associated with pain, that is, there is increased uterine activity. So, there is more of uterus is basically a muscular organ. So, the contraction of the uterine musculature is what again can lead to painful contractions, which may be perceived as painful periods. Also, there is some amount of ischemia or a drop in the blood flow which can happen into the uterine musculature, which can be responsible for the pain during periods. Also, in some women, there is more sensitization to the nerve endings, so hence the perception of pain is more. So, to say, it is very difficult to explain the pain perception of each individual. So, pain tolerance is something very, very individualistic. So, hence, some women may have more pain perceived, whereas some may not, perceive that much of pain, even though the stimulus is the same. So, it is a very, very individualistic response whenever there is a release of these local prostaglandins. So, when we look at it as gynecologists, how to manage pain during periods, so we basically try to categorize pain into what is called as primary dysmenorrhea or a secondary dysmenorrhea. So, a primary dysmenorrhea is what we call as a spasmodic dysmenorrhea, which is typically seen with the onset of menses. It usually lasts for about 24 to 48 hours. Typically, the women may perceive it as intermittent cramps in the lower abdomen, which radiates to the groin area or even to the lower back. Common feeling of, a pulling sensation in the legs may be there. For some women, the same pain perception may be a little more severe with other kind of constitutional symptoms, like she may experience a little bit of headache, lightheadedness, feeling of fainting. There may be associated nausea, uh, vomiting. When the pain is a little more severe, these women do feel a little sick, and a lot of them sometimes are not even able to get out of bed and get into their daily routine. So sometimes pain can be traumatizing in the sense that it may not allow a woman to perform her daily activities. So this is what is typically what is a primary dysmenorrhea. Whereas when we talk of it as a secondary dysmenorrhea, that means to say there is an underlying pelvic problem to it, or a pelvic pathology which is associated with the secondary dysmenorrhea. So here the woman may start perceiving the pain much before her onset of the menstrual cycle. She may start having pain even about 10 days or even 2 weeks prior to her actual menses. She may even, sense that she's going to have her periods because of the premenstrual pain that she starts perceiving. Also, the pain is quite continuous and it is more severe in intensity, and it lasts almost through the entire cycle. So, for this, we have various reasons which could be associated with the secondary dysmenorrhea. So, secondary dysmenorrhea could be associated. The common conditions which lead to problems with pain are endometriosis. Endometriosis is a concern wherein this uterine glands which are there on the inner surface of the endometrium, sometimes they start growing in abnormal areas which are outside the uterus. So typically, these endometrial tissues can start growing in the ovaries, or they can start growing outside the uterus. They can even start growing towards the posterior aspect or the behind aspect of the uterus. So there can be various deposits all through the through the abdominal cavity. So that is what is endometriosis. There can be other conditions like adenomyosis, wherein the muscular layer of the uterine wall becomes very thick, and there is, the growth of the endometrial glands into the uterine musculature. So this again can be associated with painful periods. Another important concern is association with pelvic infections. So sometimes underlying pelvic infections, or what we call as pelvic inflammatory disease, can be associated with painful periods. Of course, concerns on fibroids, which are nothing but extra growths which can be seen in the uterine musculature. These are again responsible for dysmenorrhea. So, also, if there are small projections into the uterine cavity, what we call as polyps, this is again a concern for secondary dysmenorrhea. So, basically, I just wanted to tell you the common concerns which could be there, which could be associated with the secondary dysmenorrhea. This is for us to understand as to what is the pathology and how best to treat it. So, but commonly what we see is dealing with the primary dysmenorrhea. So, like I explained to you, it is to do basically with the local hormonal effect of the prostaglandins, which is working on. So, how do we come to the diagnosis of dysmenorrhea? So, whenever you walk into the gynec OPD with concerns of pain during periods, you would have noticed us asking you many, many questions regarding your pain. So, it's important for us because a good history will kind of help us differentiate whether we are looking at a primary or a spasmodic dysmenorrhea where there is no associated pelvic issue. It is only to do with the local prostaglandins which are working in your body, or whether it's a secondary concern where we need to investigate or look further and decide and see whether anything else is there in your uterus or in the ovaries which can be troubling you, which can be the reason for your painful periods. So a good history gives us a lot of information about what is the underlying problem. So it is important for us not only to know about the pain related history, we also ask you about your uh, menstrual cycle. So, what I would like to say is whenever you have symptoms of pain, kindly observe and see if there has been any change in your menstrual pattern. Supposing you are having a normal menstrual flow of about, say, 2 or 3 days, and over a period of time it has increased to, say, about even 5 to 6 days, and your associated pain is getting worse with it, that is again significant for us, because when there is a change in the menstrual pattern, again that gives us some clue that yes, there could be some underlying problem which can be associated with the dysmenorrhea. So we may be dealing with fibroids, or we may be dealing with endometriosis, so we need to understand a little more. So first thing is observe and see if there is a change in your menstrual pattern. Second thing is the onset of menarche. So a lot of young girls suffer from painful periods. Typically, at the time of menarche, or when a girl matures, her cycles are usually anovulatory. Means the pathophysiology that I had explained to you about the ovulation and the painful periods, that typically is not there in a very young girl, or in an adolescent population. As they grow, when they are attaining the maturity of the axis which actually controls the hormones, that is when ovulation sets in. So once the ovulation sets in, these girls start experiencing pain during periods. So typically, this onset of pain during periods may happen, say, about 2 to 3 years following menarche, is what we start seeing that girls do complain of pain during periods. So these early onset of dysmenorrhea again is more towards a pointer towards primary or spasmodic dysmenorrhea, where there is no underlying usual pelvic pathology. Then other, if there is a very late onset of dysmenorrhea, like all through her initial few years a girl did not experience any pain, but towards her late 20s or in her 30s, or even much later in life, if there is an onset of pain during periods, that is a significant history that most likely could be associated with a secondary cause or a congestive dysmenorrhea. Also, we would also want to know if there is any underlying concerns, like abnormal white discharge, or excessive vaginal discharge which is foul smelling, or any change in the color, or you noticing that there is a postcoital bleed. Any of these are again significant history pointers, which again tell us more towards what could be the reason. Also, an important other factor that could be associated with dysmenorrhea is infertility. So a lot of the couples who come to us with infertility, when we take a good history, we do understand that there is dysmenorrhea which bothers them, which again could be an indicator of an underlying problem as common as endometriosis. So endometriosis typically is associated with painful periods, and very often is associated with infertility as well. So some women may experience even dyspareunia, that is pain during coitus, which is again an important history for us to understand, because again coming on to endometriosis could be associated with deep-seated dyspareunia, and also they have severe pain during periods. So a good history generally kind of alerts us or helps us give a lot more information about what are we dealing with. So once we try to understand and try to get some pointers to know whether it is only a primary dysmenorrhea where there is no associated problem, or whether it's a secondary dysmenorrhea which needs a little further evaluation, then we decide on to going on to how to manage the patient. So, of course, once we have got a good history, we do examine the patient, look for any pointers, we do a pelvic examination, look for any signs of infection, if there is any abnormal vaginal discharge, have a closer look at the cervix, try to understand if there are any signs of chronic inflammation. If needed, to take swabs from those areas to understand what kind of infection we are dealing with. So these are all important factors. And then also, if there is a focal area of, usually if there's a focal area of tenderness, then again we think about whether we are dealing with a secondary or a specific cause for the dysmenorrhea. In a primary dysmenorrhea, it's usually a vague lower abdominal cramp that the woman experiences. But sometimes women can point and say that every month I do have pain only on one particular side, either only to the left or only to the right, and it only gets worse. And then after my periods, it comes down. So these are all like focal pointers to say that, okay, she has a focal problem in that particular area. So we may be dealing with some kind of ovarian cysts or endometriotic cysts, which could be associated with the pain. So Once we are doing the pelvic examination, we do examine and try to understand if there is tenderness, if there is, we look at the uterine size, we look at the ovaries to the extent that we can make out on the pelvic examination. We try to understand whether there is any kind of fullness or any tenderness on examination. But having moved on to the era of sonography, I would call it the gynecologist's third eye. So we rely a lot on ultrasound pelvis to actually help us diagnose problems related to the pelvis. So, ultrasound has a very important role to play in the diagnosis of pelvic pathology. Most often, we rely on ultrasound after our physical examination, because in the same sitting, we can understand exactly what is happening. Are we dealing with a problem in the uterus, a problem in the ovary, or is it just that we are dealing with the primary dysmenorrhea? So ultrasound will help us understand whether there is, thickening of the uterine musculature, whether it's adenomyosis, are there fibroids or tumors growing inside the uterus, is there an ovarian cyst, is there a chocolate cyst, are these pointers towards endometriosis? So a lot of information is gathered through a good pelvic ultrasound. So, ultrasound is the key to diagnose problems that are associated with pelvic pathologies. Of course, we may take help of other modalities also, like wanting to know her complete blood picture to understand if there is any focus of infection, doing ESR, trying to understand if we need to take any swabs for culture and see if there is any underlying infection that needs to be treated. So these are all other tests which do help us in understanding, getting more information apart from the ultrasound. Once we kind of understand, so by the time we are done with the ultrasound and the basic blood test, we can come to a conclusion as to what we are dealing with. In very, very rare scenarios of endometriosis, where we do not see a presentation of cysts in the ovaries, it's only then when, the history would typically tell us that we may be dealing with endometriosis, but on the ultrasound we are not able to point out and say that, okay, this is to do with endometriosis. So in very rare cases, and usually these are couples who keep coming back to us with infertility or other related problems like dyspareunia. So in these kind of scenarios, we may need to look at doing a laparoscopy. But of course, laparoscopy is not only diagnostic, it also helps in therapeutic management. So if there are small spots of endometriosis that are seen, they can be fulgurated or they can be cauterized, so that the woman also has symptom relief in the same sitting. So coming on to, once we have made the diagnosis of dysmenorrhea and the reason for the dysmenorrhea, or categorized it as whether it is primary or whether it is secondary, we move on to how to manage the patient. So when it comes to primary dysmenorrhea, a lot of women do find symptom relief with local measures like abdominal massage, or using hot compresses, or lying down prone or on their tummy, which kind of gives them a lot of symptom relief. So these are all absolutely okay to do, and you can find which method actually suits you better. So you can always take help of these methods. So important thing is, again, keeping yourself well hydrated and taking a good fiber diet, which doesn't allow you to get constipated, and sometimes will help you have easy bowel movement as well, which again doesn't trouble you during your periods. So apart from these local remedies, some women have to take help of painkillers or analgesics. So, if you can recall, I had told you that primary dysmenorrhea is typically because of the hormonal imbalances, where there are increased prostaglandins in certain women. So, basically, these analgesics or the antispasmodics that we prescribe, and we say typically take it during your periods. Only when your flow starts, you start the medication and continue it till whenever you experience your pain, for about 2 to 3 days on during every menstrual cycle, which is absolutely okay to do. I feel no woman should actually suffer with pain during periods, which is, which sometimes impairs her quality. She is so bed bound, she's not able to carry on her daily activities. So Do not wait for the pain to strike you so hard that you are kind of uh, paralyzed for the whole day. That is absolutely not necessary. It is okay to take medications during your periods. So generally we prescribe you very mild antispasmodics or anti-inflammatories, which basically work as these prostaglandin inhibitors. So they kind of reduce the prostaglandin production in your body, so they do not have any other kind of hormonal impact on your menstrual cycle or on your hormones. So these are the common myths. So that's why I'm bringing up this, because a lot of women fear that every month I take medications and I would be kind of habituated to these medicines, which is absolutely not true. There is no need for anybody to suffer with pain. You can take help of analgesics or antispasmodics. But one thing you need to remember is, are these medicines giving you relief? Sometimes women come to us saying that we have taken these medications, but still I don't have symptom relief. That is when these women will need more detailed evaluation to understand the primary problem. So, if the dysmenorrhea is so severe, then there is most likely an underlying pelvic pathology which needs to be, further evaluated. So simple, very commonly used medications are like mefenamic acid, which work to reduce the cramps as well as the bring down the prostaglandins produced in your body. So we prescribe it depending on the body weight and depending on the pain symptoms. We prescribe it about 3 or even 4 times a day, which is usually taken after food. So typically, for dealing with primary dysmenorrhea, it is to just bring down the pain during the periods. Coming on to secondary dysmenorrhea, that itself is like a very huge topic, I would say, which we cannot do true justice in one setting, because every topic needs to be dealt with in detail. But in a nutshell, I would say that when your pain is getting worse, it's not getting relieved with symptoms, or you have associated other problems, not only pain during periods, but you also have heavy flow during your periods, or you have any abnormal discharge during your periods, or you're experiencing other problems like fertility related issues or painful coitus, then definitely we are dealing with the problem in the pelvis, which will need further evaluation. So to deal with the pain, which is pain or the bleeding related issues, we would give you certain medications which you would use during your periods, but that would not be the sure shot solution. So you would need further evaluation and understand whether it is endometriosis, whether it's adenomyosis, or whether we are dealing with fibroids, or whether it's polyps. And then accordingly, we do targeted or very specific treatment towards the cause of the dysmenorrhea. So this is how we as gynecologists look at pain during periods. So this was what I wanted to tell you all, that there is no need to silently suffer with problems. You can always come up with your issues, get a good history elucidated when you come up and tell us exactly typically how your periods are, and give us a proper accurate information. I would say watch out and see, because you know better about yourself. So when you watch out and notice any unusual or untoward change in your periods, or unusual intensity of the pain during the periods, do seek help, and do get in touch with your gynecologist, so that you are guided early at an early stage and your suffering is less. So any questions, I'm always open to. So I think if we have no questions, then in that case, I would like to end this session. Thank you for your patient listening.